Okay, so this is going to be my week 7 health assessment video. So this is going to be kind of like my practice head to toe assessment. So the first thing I would do is just knock on my patient's door, provide privacy behind me, do my hand hygiene. When I walk in, I would acknowledge my patient, introduce myself, let them know what I'm about to do and about how long it's going to take, and then thank them for letting me do the assessment. Then I would ask them their name and their date of birth, and I would match it with their ID band. I would assess for any pain, and I would assess for any allergies. So moving on to my general survey, first I want to note any like acute distress, so any nasal flaring, muscle retractions, anything like that I want to note. Next I would ask them their orientation questions. So first I would just note that they're awake and alert. I would ask them their name and their date of birth. I want to know, so that would be the person. Then I would assess place, so I want to know where they are. Time, you could ask the month or the year, and then situation, you can ask them who the president is, or kind of why they're here, or what's going on in the world. So then I would document it as, patient is alert and oriented ×4. Then I want to note their behavior, so just noting that their behavior is appropriate to the situation, as well as mood and facial expressions. And then affect kind of goes in there as well. Just making sure that it's appropriate to the situation. And then speech should be clear. After that, I'm going to move on to my skin and nails. So just kind of noting my patient's skin, it should be appropriate to ethnicity. I'm going to note any lesions, wounds, or incisions. Then I'm going to move on to my nails. So just noting the color, they're pink. My nail beds are pink. There's no clubbing, there's no ridges. I'm going to assess for cap refill, which should be less than 2 seconds bilaterally, and it is. And then I'm going to go through and just kind of palpate my patient's skin and just make sure that nothing is cold or more warm than another extremity is. After that, I'm going to move on to my head, face, and neck. So I'm going to just kind of palpate and inspect for any lesions or infestations. I want to note symmetry of the face. So you can look at the mouth, it should be symmetrical, same with the eyes. So you don't want to see any eye drooping, one or the other. And then the nose, just making sure that the nose is proportional, that it's in the right spot. It's not obviously like deformed or anything like that. Moving on to my eyes, so just kind of looking at the external eye, just noting any discharge or redness. When I pull down the conjunctiva, it should be pink and moist. My sclera should be white. Moving on to my pupils, so ultimately when you document, it's going to say PERLA. So pupils equal, round, reactive to light, and that they accommodate. So you want to note the size, and it should be anywhere from 3 to 5 millimeters. And then when you do note the size, you should know that they're round, that they're equal, and then you want to do your reaction to light. So you want to just make sure that they react, and then your accommodation. So you just hold an object out, or you can have them follow your finger or the pin light, and just have them focus on the pin light and follow it. So you're going to move it in, and then you're going to move it out. And then that was your accommodation. Moving on to the ears, so just looking at the external meatus for just noting any discharge or any redness, and then conversationally just noting any hearing loss. So if there was hearing loss, then you would kind of just assess further. Moving on to the nose, so just kind of generally looking for any deformities, any redness, inflammation, asymmetry. And you can also look at the internal nodes and look as well for the inflammation, redness, and asymmetry. And you also want to note any drainage. And then you want to test for patency of both nares. So you would just have your patient hold one side, breathe in, and then the other side, breathe in. So bilateral nares are patent. Moving on to mouth and throat. So lips should be pink and moist. Note any cracks or anything. Look for, signs of dehydration, especially in those mucous membranes. I always have my patient like stick out their tongue just so I can kind of see a really good picture of like their mucous membranes, buccal membranes, tongue, gums, all that kind of stuff. So the tongue should be pink and moist as well, same with the gums. If my patient had any dentures, just make sure that they're, you know, like well fitting, that kind of stuff. So definitely look for like lesions, maybe have them take them out and look for lesions under them as well. So after my mouth and throat, I'm gonna move on to my respiratory assessment. So first, just looking over my patient, I wanna make sure that they're not using any, that they're not in any distress, not using any accessory muscle use. So when I listen with my stethoscope, I am going to listen in like a rough Z pattern. I'm gonna listen over bare skin, and then I'm gonna listen on inspiration and expiration when I'm doing it. So I'm gonna start with my anterior. So I'm gonna go ahead and listen to my right upper lobe, left upper lobe, and then I'm gonna do my right middle lobe, have my patient lift up their arm, and then I'm gonna do my right lower lobe while I'm over here, and then move on to my left lower lobe over here. And then lungs should be clear bilaterally to auscultation. So that was my anterior. So moving on to my posterior. So I'm actually going to use my board again. Oops. Okay, so with my stethoscope, I would just start over here. So I'm going to just do my right upper lobe, left upper lobe. Then I'm going to do kind of like my right middle lobe, but I'm going to note that my scapula. So I don't want to listen over, obviously, the bone. So right middle. And then I would go down to my left lower lobe, right lower lobe, and then you could even go a little bit further into the more like base of the lungs if you needed to. So you could go even further down. Again, you're listening in like a Z pattern, listening on inspiration and expiration, and you're listening over bare skin. Moving on from respiratory, then I would do my cardiac assessment. So starting out, just upon inspection, I'm gonna just make sure that my patient doesn't have any JBD. Then I'm going to assess their carotid pulses. So just assessing one at a time sequentially. Should be regular rate and rhythm, which it is. So 2+ bilaterally on palpation is what kind of you would document. Next, I want to assess my radial pulses. So I would do my left and then my right. So on a normal patient, you would assess them both at the same time, just to make sure, like strength-wise, that one isn't like 1+ and the other one is like 2+. So obviously, I know I did it like one at a time, but normally you would do them at the same time. Okay, after that, I'm gonna listen to my heart sounds. So again, I would wanna be doing this on inspiration and expiration. So I'm gonna start with my diaphragm and just listen. And then I would go through and listen with my bell just to assess for any murmurs. So I'm gonna start with my diaphragm. So this is gonna be my aortic, second intercostal, right sternal border. This is gonna be my pulmonic, second intercostal, left sternal border, my herbs, third intercostal, left sternal border, and then my tricuspid valve, fourth intercostal, left sternal border, and then my mitral is going to be left midclavicular line, fifth intercostal space. And that is also noted to be like my apical pulse. And then I would go through and listen with my bell. So this is my aortic, my pulmonic, my herbs, my tricuspid, and then my mitral. And then after that, that pretty much wraps up my assessment. So I would reassess my patient's pain. I would offer them anything, so see if they needed anything to drink or use the bathroom, ask if they needed anything else before I left. I want to make sure, if I was in the hospital, definitely want to make sure that their call light is within reach, bed is in lowest position, wheels locked, you know, that the bed is locked, side rails are up at least ×2, and that their bed alarm or chair alarm is on. And then I would thank my patient. I don't think I already said that, sorry. And then do my hand hygiene on the way out, and then let them know that I'd probably see them like probably in about an hour. And that concludes my week 7 health assessment video.